We are excited today. We've got the one, the only Mike Stagg here to talk to us about hands-only CPR and AED essentials. Mike has some serious street cred when it comes to CPR and AEDs, and we'll let Mike talk about his history on that, but he's a pretty big deal.
Yeah, something like that, Jason. Let's keep it there. So before I came here to work at the trust, actually, I worked for the American Red Cross. So I was over all of their health and safety programs like CPR, and lifeguarding and water safety and things like that. I actually started my career in local government as a lifeguard, and as a worked my way up as a aquatics director and as a recreation director and things like that. So this kind of stuff, this hands on this CPR stuff, it hits home. Um, so here's hopefully we got some good information for you. We got a lot to get through here in just 20 minutes of time. So let's get moving. Just a disclaimer first off, this is not a certification course. Okay. If you'd like to get certification in CPR, I encourage you to get in touch with your local fire department. They do classes all the time, community classes that you can get signed up for. You could also, if you have a local recreation center, swimming pools, things like that, they're required to train and make sure all of their staff is certified in CPR. So you can get in touch with them too, and they can get you taken care of. But again, not a certification course here. This is just information, but it's good information. It's information that can definitely save someone's life someday. So what we're going to cover today, what is hands-only CPR? Okay, what that is, how do you do it? How do you perform it? And what's an AED? Like, what is that machine that's sitting on your wall that you walk past almost every day? And what does it do? And how do we use it? Okay, this is important. This is important information because cardiac arrest is the #3 cause of death in the United States. Now, golf courses are the 5th most likely place for a sudden cardiac arrest. Those of you who have been golfing before, you know that's the truth. And this statistic here is a little sobering. It's that women are 50% less likely to receive bystander support for SCA, sudden cardiac arrest. Now, why is that? Why is it that women are 50% less likely, even though women are statistically more likely to have a sudden cardiac arrest? They are less likely to receive bystander support for sudden cardiac arrest. We'll talk about that here in just a minute. But the reality is hands-only CPR triples the chance of survival. So this is a great skill to learn. It's a great skill to be familiar with so that if somebody collapses or goes down in the office, you can help. You can take care of them. If a member of the public comes in and they go down because they were complaining about their water bill too much and then they had a sudden cardiac arrest, you can help them. Or if your friend next to you collapses, you can help them. There are reasons why we don't give help, though. These are some of the reasons why women are 50% less likely to receive that help. It's because in our society, right? You don't want to be accused of touching somebody inappropriately. You got to put your hands on somebody's chest. You don't want to do that inappropriately, right? We worry about getting sued. We worry about causing physical injury. So we just kind of shy away and think, oh, I'm not going to do that. Okay. But realize we have protections. You don't have to be scared. You don't have to be scared of getting sued because we have really Good Samaritan laws here in the state of Utah. Good Samaritan laws, what they do is they protect citizens who step up. Okay. So if you're going to perform CPR on somebody, you don't have to perform hands-only CPR. You don't have to worry that you're going to be sued or there's liability for you for putting your hands on somebody's chest and pushing and breaking their ribs off their sternum if you need to. Okay? Because you're doing the best you can to help somebody else, Now that is the main thing that Good Samaritan laws do. They provide protections for you. If you step up and you help, and you're doing the best you can to help save somebody's life, don't be afraid to do something. It's always better to do something than nothing at all. Okay? Realize we have these laws here and they're here for our protection. So why are we talking about hands-only CPR today and not just referring you to a full CPR course? Well, it's because hands-only CPR, it's easy. It is really, really easy to do. Um, and it's just as effective, or maybe it's more effective than regular traditional CPR. You know, CPR with compressions and ventilations, and where you have to give mouth to mouth and breathe into somebody, right? Hands only CPR is maybe more effective than that. But why is that? And it's because it's easy to do. Traditional CPR that requires cycles and compressions versus ventilations and things like that, there are lots of steps that go into that. And it's not as easy as you might think. Hands only CPR, it's incredibly easy. And when things are easy, we tend to do them more. If somebody collapses in front of us and we know how to do hands only CPR, we may be more willing to do that CPR than we would be to give CPR and ventilations. That's why it can be more effective, because more people are willing to do it. And the response time for hands only CPR is incredibly quick, because there are really only 2 steps to hands only CPR. Okay, we'll talk about those in a minute. What does CPR do? Hands only CPR, what it does is it keeps blood circulating to the other vital bodily organs. So things like the brain. Okay. Now, in traditional CPR, where you're giving compressions and you're giving somebody air, what you're doing is you're manually doing what the body can't do for itself. You're breathing for them by giving them breaths, and then you're pumping the heart to pump that oxygenated blood throughout the body. Now, with hands-only CPR, we're taking out that ventilation portion. But when we're giving compressions to somebody and manually pumping the blood throughout the body, what the body will tend to do is it will have natural aspirations where they will take in some amount of oxygen just by doing the compressive work. So when the compressive work is going on, they're still getting something. They're still getting some oxygenated blood that's circulating to their brain to help to keep their brain alive. So that's why it's so important that we just help somebody, because that's what we're trying to do, is keep that brain alive until advanced medical personnel can come. Hands-only CPR really only has 2 steps, which is why it's so incredibly easy. Checking and calling is step 1, and number 2 is giving those chest compressions. So let's talk about that. When you use hands-only CPR, man, it's appropriate to use hands-only CPR whenever somebody collapses. If somebody goes down, it's appropriate to use hands-only CPR. It's also appropriate to use hands-only CPR if the person is unconscious and not breathing normally. Okay? If you can't wake somebody up and they're not breathing normally, it's important, and it's a appropriate time to use that hands-only CPR. So step 1, check and call. Okay? First thing you're going to do is you're going to check the scene for safety. As selfish as it may sound, your life is always more important than somebody else's. So that means, say somebody gets hit in the road outside of your building, and there's still cars whipping around, but you know that person needs help. That scene is not safe for you to go and help that person yet. Okay? So you make sure that traffic is stopped, that the scene is safe before you go and help somebody. Next step is to make sure you put on your personal protective equipment. Okay? You don't know what nasty stuff that person has, and you don't want it. So you want to make sure you protect yourself. Okay? Put on your PPE, those latex-free disposable gloves. So having a set of gloves in your desk, in your truck, in your office area somewhere is a really good best practice, because if somebody goes down, you want to make sure you're protected. So first we're going to check the scene and make sure that scene's safe. Once the scene's safe, then we're going to check the person. The way you check an unconscious person is you want to go over to them and use what we call a shout, tap, shout method. You're going to tap them on the shoulder and shout, "Hey, hey, are you okay? Hey, hey, are you okay?" Shout, tap, shout. "Hey, hey, are you okay?" You want to hit them on the shoulder. You're trying to wake this person up if they're sleeping. Okay? You're trying to get this person to respond if they've fallen unconscious. Occasional gasps of this person, occasional gasps of air, things like that. That's called agonal breathing. That's not normal breathing. Normal breathing is that normal breathing that you and I are doing right now. Okay? So when you check that person, your shout, tap, shout method, "Hey, hey, are you okay?" Tapping in them on their shoulder, and seeing if they respond. If they do not respond, if you don't get them to wake up, you got to call 911. Okay? If there's no response from that person, immediately call 911. That is a life-threatening emergency. Anytime anybody is unconscious and unresponsive, make sure you call 911. When you call 911, take your phone and hit that speaker button and use the speaker mode. Okay? So you can set the phone down and continue your care if you need to. Give detailed information about where you're at to the 911 dispatcher. Tell them this is the building I'm in. This is the room I am in. Let them know where you're at so EMS knows how to access that building. Okay. And then last, listen. Listen to the 911 dispatcher, and they will walk you through different things that they may want you to do. Okay. Having your cell phone and putting it on speaker mode allows both your hands to be free so you can start hands only CPR if you need to. Okay. All right, let's keep going. Now, hand position. Where do you put your hands? What do? You take the heel of one hand and you put it right in the center of that person's chest. Okay, the heel of one hand right in the center of that person's chest. Then you're going to put your other hand on top, interlace your finger, and then interlock your fingers. So your heel here is the one that's pushing right in the center of their chest. Okay. Then after you've placed your hands on your chest, you're going to position your body. Take your body and leverage your body up over that person so your shoulders are directly over your hands. With your shoulders directly over your hands, make sure you lock your elbows out and keep your arms straight. Then you're going to, when you're giving compressions, you're going to use your body weight to push on the chest. Okay, so look at these diagrams here. In the bottom left diagram, you can see how the rescuer has her arms bent. Okay, you're going to get really, really tired really, really quickly if you're just using your arms to try and give these compressions. You want to use the weight of your body to push down on somebody's chest to give that compression, okay? Because when we're giving compressions, we're pushing hard, okay? You're pushing and compressing that chest down about 2 inches, okay? That's a long way. When you think about that, that is a long way down. Get out a ruler if you got one at your desk, pull it out and see how far 2 inches is. That's a long way. Hey, you're pushing dang hard. So you want to use your body weight. When you're giving those compressions at least 2 inches down, your compressive rate should be about 100 to 120 compressions per minute. So you're going pretty fast, right? About 2 compressions per second. What you want to do, though, is you want to make sure the chest has time to recoil in between each of those compressions. What that allows the chest to do is pop back up and recoil back so you can give a full 2-inch compression on your next push. Now, that's important that we allow that so we can get that full compression down. When you're allowing the chest to recoil, you don't have to take your hands off the chest. Your hands can stay on top of the chest the entire time. Just make sure that you're letting the chest naturally recoil back up to its neutral position. Now, when we talk about rate, how do you know what's fast enough? Okay, because 100 to 120 compressions, that's fast. Okay, and now here's your playlist. They've done studies that have shown that in order to help you keep up on your CPR compression rate, pair it with a song. If you compare your compression rate with a song that has 100 to 120 beats per minute, you are more likely to remember how fast you should push on somebody's chest. Now, we've all heard some of these songs before on that 120 compression playlist, right? The I Will Survive, ha, 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 Stayin' Alive by the Bee Gees, right? Just Dance by Lady Gaga. The Baby Shark song. I don't know the name of the artist, but there's the Baby Shark, doo-doo-doo. It's that one, right? The one I prefer, the one I teach a lot, another one bites the dust. It's a little bit more morbid. It's kind of not where we're trying to go. Makes the class laugh a little bit, right? But it's the same 100 to 120 beats per minute. So what I challenge you to do is go find some of these songs, put them in, and listen to it. And then just mind that action with your hands on those compressions along with the beat of this song. You can sing the song while you're giving the CPR. You're going to remember it. I promise you will. Hey, when do you stop, though? Once you've started hands-only CPR, once you've started pushing on somebody's chest, when can you stop? Well, the first time you can stop if you see an obvious sign of life, like somebody starts breathing or wakes up. That's an obvious sign of life, okay? If another rescuer arrives and takes over for you, somebody comes and they take over for you, then you can stop, okay? You are too tired to continue. Like if you push on that dang chest one more time, you're going to pass out, okay? You could stop then. The other time when you can stop, if EMS arrives and takes over for you. Don't just stop when the paramedics pull up or when they roll in the building with the gurney or when you see the ambulance pull up. Don't stop then. Keep going. Many times when the paramedics arrive on the scene, if they see you doing a good job with your compressions, they're going to let you keep going. They'll let you keep going while they get their things set up, okay? So don't just stop when you see somebody. Wait till somebody takes over for you before you stop those compressions. Other times when you can stop, the scene becomes unsafe. Okay, the building starts to fall down on you. Um, there's a lightning storm outside and it's unsafe for you now. Now you can stop CPR to save yourself. Okay, and the last time you can stop is when an AED is ready to use. Okay, when an AED comes and is ready to use for you. So what is an AED then? An AED is an automated external defibrillator. Okay, you've probably seen these in the office. You've seen these machines. You may have them on your truck. You may walk by it every day when you come into the office or whatever. So what is that thing and what does it do? Okay, an automated external defibrillator or an AED delivers an electrical shock. That electrical shock is known as defibrillation to the heart. And what it does is it allows the heart to reset itself. What's going on in the majority of sudden cardiac arrest is the heart has been put into one of two different rhythms. It's put itself into either what's called ventricular tachycardia or VTAC or ventricular fibrillation or VFib. Okay, in ventricular tachycardia, it just means the heart is beating way too fast. It's beating way too fast, so the ventricles can't sufficiently fill up with blood to pump it out through the atria to the rest of the body. So you don't have a pulse, or you go down and you go unconscious. Or there's ventricular fibrillation, where the heart is kind of just in this irregular, really weird rhythm, and you're not able to sufficiently pump blood throughout the body. What defibrillation does, what the AED does to the heart, is it sends an electrical shock through the heart, and in effect, what it does is it stops the heart. It stops the heart and says, knock it off, quit doing what you're doing, and get back to a normal sinus rhythm. Okay? If somebody is asystole, that flatline thing, your normal AEDs that we have like here in our offices and things like that, they can't do anything for that. They don't restart hearts. What an AED does is effectively stops the heart and allows it to reset itself. Okay? So there are some steps in when you should use the AED. When you should use the AED is if somebody is unresponsive and not breathing, it's appropriate to use an AED. Okay? Well, how do you do it? What do you do? Okay? It's easy. AEDs are idiot-proof machines. Okay? You just turn it on and you listen to it, and it tells you everything you should do. So your first step, turn it on. Second step, listen to it. And it'll tell you exactly what to do. Okay? It'll tell you to bare the chest. So you got to completely bare the chest of the person because you have to make sure that those AED pads are sticking on somebody's skin. Okay? Bare the chest of that person, then attach the pads as shown in the pictures. Each of the different pads has pictures on them. It shows you where those pads go. Okay? Your AED could be different than the AED you see here in the picture. It could be different than the AED you go through in a training class. Okay? It's important to make sure you're familiar with your AED and the type of pads you have. For the most part, those pads are going to be they'll have a two-pad system. One pad will go on the victim's upper right chest, and the other pad will go on the victim's lower left side. That is so when that electrical shock is delivered, it goes directly through the heart. Okay? Some of these pads are a one-pad system that are shaped like a Z. Other of them, it's just one large pad. Okay? Make sure you're familiar with your AED pads and how they work and what they look like. Again, listen to the AED. It's going to tell you what to do. Next thing after you've attached those AED pads is you may need to plug in the connector. Okay, you need to plug in the leads into the actual AED itself. Once it's plugged in, the AED is going to come on and it's going to say analyzing heart rhythm. Make sure you back away from the person and you ensure that no one is touching that person. Because when the AED is analyzing the heart rhythm, if you're touching that person or if somebody else is touching that person, it may detect your heart rhythm. It may detect a normal sinus rhythm and say, no shocks advised because this person doesn't need it. Okay? Putting an AED on somebody doesn't mean it's going to shock them. Putting the AED on somebody is telling you what's going on. The AED is going to tell you what to do. So even if somebody has a heartbeat, has a normal sinus rhythm, but they're just unconscious and not breathing normally, and you place those AED pads on somebody, if they don't need to be shocked, the AED is not going to prompt or give a shock to somebody. It's only when it detects that it can shock a rhythm, okay? Now, after the AED analyzes and says it can determine if a shock is needed, it'll charge up. If the AED needs to, it'll charge up and it will tell you what it's doing. It'll say something like shock advised, charging, stand clear. The AED will charge up and then it will notify you if you need to push a button. Some of you have semi-automatic AEDs, which means you got to push a button. Others have automatic AEDs, and an automatic AED will charge up and then it will give you a countdown, a 3, 2, 1 type thing, and then it will sound a loud beep, and then it will shock the person. Before pushing the button, or when the AED says it's going to shock, make sure you or nobody else is touching that person. Okay, again, the purpose of the AED is to stop the heart, to allow it to reset itself. So if that's the case and you or somebody else is touching that person and you get shocked by that AED, it could potentially stop your heart as well. Make sure you tell everyone to stand clear, stand back, and get away so that nobody else gets shocked. Okay? And then listen to the AED after the shock is delivered. It's going to tell you again what to do. Continue CPR or check vitals. Okay? It will tell you exactly what you should do. So AEDs are simple and easy machines to use. Don't be afraid of them. Just use them. That's what helps and brings people back. So now, if we've got the AEDs though in our buildings, we have to be sure that we care for and maintain them. Okay. Now, AEDs have two consumable parts. They have pads and batteries, which are both consumable things that have expiration dates. Today would be a great day to go and check your AEDs and make sure that all of your pads aren't expired. Make sure your batteries are not expired. Okay. They all have expiration dates on them. Make sure that you keep those things current. And then look at your locations. Kyle, we should maybe think about having an AED in every public building. Okay. Just so that if something happens, we have a device there to help and take care of somebody. Now, I know we went through this stuff a lot really, really quickly. And again, not a certification course, right? So just a quick summary for you. Somebody collapses, check the scene, make sure it's safe for you to go into. Then put on your personal protective equipment, protect yourself. Check the person. Hey, are you okay? Shout, tap, shout, right? You get no response for that person. Call 911. Call 911. Then two hands right in the center of the chest, interlock your fingers, position yourself directly over the patient and lock out your elbows. And then push hard and fast in the center of the chest. Remember, 2 inches, 120 beats per minute. That's a lot. That's a lot of compressions in a very short period of time. Okay. Push hard and fast right in the center of the chest and get the AED there and use the AED as soon as possible. Remember, the worst thing you can do is nothing. The worst thing you can do is just look at that person and think, dang, that's too bad. Or call 911. Okay. Just do something. Call 911. Get an AED there. Put the pads on them. Let the AED talk and tell you what to do. Push hard and fast right in the center of the chest. Think of a song. Think of that, one of those songs on that playlist that you can play over and over in your mind while you're doing the compression so you keep the rate up. All right. Again, went through it really quick. Jason, do we got any questions in the chat room?
Folks, just a reminder, if you've got questions or comments, type those into the chat box and we'll get Mike to answer those right now. Now's your time to stump the dummy, right? This is pretty important. We did have one comment that we didn't have any heavy metal songs included.
Yeah, we did. I'm sorry.
In that list. And I responded by, I think Holy Diver by Ronnie James Dio is probably about the right. Probably
Yeah,
about
Holy Diver's right there.
Yeah, I think that's probably good. So all right. If I start CPR and then someone arrives with an AED, do you stop and put it on then continue the CPR?
That is a fantastic question. When an AED comes, immediately stop what you're doing. No matter if you're on, compression number 94 of your one in the 1 minute thing, who cares where you're at? Once the AED arrives on the scene, prep the AED and get the AED ready to use and get that on that person. Great question.
Yeah, because the AED is actually going to save them. CPR just buys us time, right?
Yep. CPR just buys us time. AEDs bring somebody back.
All right. Kevin had a good suggestion there. He says Highway to Hell fits.
That's another good one.
May have to add that to the slide.
Add that to the CPR playlist for sure.
Very good. Great questions, folks. That looks like all the questions that we have. Any final words?
No, I mean, just think about this. This is important stuff here. Um, if you're again, if you're more interested in this than what we've covered here, look for a certification course. Look to a fire department or something like that for a certification type course. But it's always better to do something rather than nothing. And do something rather than nothing. Help save somebody's life by using just these simple skills. Don't be afraid of your AEDs either. They're there to help. They're there to save lives.
Use them. Great. Thanks, Mike. Awesome presentation here. We've recorded the session. We're gonna put it up on our YouTube channel, hopefully later today. And so you can share that with others and review it yourself. Thanks, folks, for all you do out there. Go out and have a safe day.
Thanks, everyone.